Now to our health lead and a dramatic announcement today from Health and Human Services Secretary Robert F. Kennedy Jr., who says the agency will cut 10,000 jobs as part of a major overhaul. Now that is on top of the 10,000 who already voluntarily resigned. HHS says these jobs will include cuts to the Food and Drug Administration, the CDC, the National Institutes of Health, and the Center for Medicare and Medicaid Services. Dr. Megan Ranney joins me now. And Doctor, I think the difficulty, in this moment, given the scale, certainly, but also in terms of the overhaul of U.S. health agencies, is to try and explain what this means, what impact this would have. Do we have a sense of that at this early stage?
It's too early to know for sure what the impact is going to be. There was not a lot of transparency either in the video that RFK put out or in the fact sheet, but I can predict a few things. The first is the stated agenda is to make our food, our pharmaceuticals, and all of America healthier. It's difficult to imagine how that will happen with an almost 20% cut in the Food and Drug Administration's workforce. They say that no one who has regulatory capacity is going to be cut, but I have trouble thinking and imagining how we are going to get drugs through to approval, how we are going to ensure the safety of infant formula, how we're going to check on the nutritional content of food if we don't have a workforce there. So that's part one. Part two is the cuts to the CDC and NIH put our ability to track emerging epidemics at risk, both infectious and non-infectious. So obesity and COVID intersected. We need to be able to look at both of those. If we don't have scientists there, it's going to make it tougher for us to address whatever is coming down the line, whether it's bird flu or measles. And then the third and biggest thing that I'm worried about, Phil, is the ripple effect on state and local health departments. This 10,000 person cut is on top of over $12 billion in cuts from CDC to state and local health departments yesterday. Most people don't understand that the federal workforce doesn't all sit in DC and Atlanta, fans out across the country. It supports doctors and hospitals and superintendents in keeping communities healthy. And I'm deeply worried about how that ripple effect is going to play out as we get more details about what these cuts are.
You know what's interesting is you talk to government officials, you talk to folks from HHS or formerly of HHS. They acknowledge, look, there are places, there are things we could do to make this more efficient. There are divisions we could combine or modernize, or you use the term you'd like. This isn't it. What would be the way to do that in your view?
It's exactly it. This is the hatchet rather than the scalpel being taken to this problem. Kennedy's been in this job for 3 weeks. It's a 90,000 person agency. In an ideal world, he would meet with folks, learn what their jobs are, and then think strategically about how to reorganize, how to prioritize the things that matter, and what can be pushed off to state and local health departments or to communities versus what needs to be kept centrally. This sudden cutting that seems almost haphazard, it is difficult to imagine that we're not going to lose key services. And right, in fact, we've already seen that where people were fired from the FDA and then rehired. I wish that he'd taken a little more time to assess what he was walking into before cutting large swaths of the agencies.
The mission that the secretary laid out or talked about, which tracks with what he campaigned on, it tracks with what he talked about, and has a lot of fans talking about, I should say, in the kind of MAHA space. We saw it at his confirmation hearing. This idea of America's epidemic of chronic illness, in the epidemic of chronic illness, focusing on safe, wholesome food, clean water, and the elimination of environmental toxins. You kind of pointed at this. What exists now with these cuts that can actually deliver on that? Is that supposed to be what HHS is doing?
That is what that is the basis of public health, Phil.
Yeah.
Right. The whole goal behind public health is that we help people be healthy, help them not get sick. And then if they do get sick, help them get healthier faster. There are lots of programs across the country that are trying to get healthy food into the hands of pregnant moms and kids, programs that are working to stop fentanyl overdoses, crisis hotline to reduce suicide, ongoing science to examine the effect of forever chemicals on the development of our children and on fertility. Those are the things that are at risk when there are these sudden kind of ham-handed cuts. And I do, again, worry about that mismatch between the agenda and the actions.
Yeah, the concentric circles of goals and agendas of the new secretary and things that already exist in some form or fashion, maybe just need to be connected or threaded together. It'll be interesting to see the recognition of that in the weeks and months ahead. Dr. Megan Ranney, thanks so much.